Welcome everyone to our Camp Zoom event. My name is Mimi Hadi, and I'm with Camp Philadelphia. And for anyone who's new to the group, Camp, it's Council for the Advancement of Muslim Professionals. So we're doing some Zoom events so that we can stay connected with our members. This evening, we have Dr. Neelam Khan with us. She's a senior dermatology resident at a hospital in Brooklyn, New York. Her hospital was designated a COVID-only patient hospital, and she got a chance to volunteer to help take care of COVID patients. So I just want to welcome Dr. Neelam Khan, who's coming to us from Brooklyn. So Dr. Khan, it's so nice to see you again after a few years. I know last time I met you in Philadelphia at the Camp Iftar. How are you doing this evening in Brooklyn?
It's good to see you again as well, Mimi. Thank you so much for having me. I'm hanging in there. I mean, things have been tough, but alhamdulillah, I'm doing well. So glad to be here.
Good. Well, I wanted to start by, maybe the beginning. You were, or you are in your final year of dermatology residency in Brooklyn. And then, your hospital was designated a COVID-only hospital. So now, did you feel that you had sufficient resources? Did you have enough, PPE? How did you feel? Did you feel comfortable with having enough resources, or did you feel like you were lacking in any way?
So I think, it was very tough because nationwide, there were shortages of so many different types of supplies. And when our hospital was designated COVID only, they were very transparent about the fact that, they had run out of the gowns and that we're going to be providing us with ponchos and, just all sorts of different ways in which, we had to try to protect ourselves. We were fortunate to have a resident at our hospital who raised a bunch of money with a GoFundMe campaign, and but it did take some time, to source and get the appropriate supplies from the right vendors. And while that was all happening, friends and family donations, I think that was the number one way in which I was able to get, everything that I felt like I needed to work on my COVID unit. But I will say, even in ordering everything, certain things from Amazon, there were delays, shipping delays that were happening. And I will say my first 2 days, I didn't have a hazmat suit. They had gowns in the hospital, but, my sister had said, I need you dressed the way that they are dressed in the COVID unit, fully geared up in the videos that you see from Wuhan. And so in getting me that hazmat suit, it hadn't come from Amazon yet. So we had also ordered a beekeeper suit. And so I actually started my shifts wearing a beekeeper suit, which, I also had my N95 surgical mask and face shield, goggles on top of it. But the coverall that I wore to kind of protect myself on underneath, that was what I could get. And so it was a lot of just makeshift, do what you feel like you need to be smart and be safe as much as you can and hope for the best.
Right. Yeah. And that's a good point. I think the whole situation caught the country off guard, we didn't really, no one was really prepared anywhere, but especially New York being one, probably, I think I've heard New York was probably the state that was hit the hardest. Now, walk us through the types of patients that you were seeing. Like, how many patients a day were you seeing? And would you say you were seeing more like an elderly population, or was it patients of all ages that you saw coming in there?
Yeah. So on our unit, we had about 20 to 25 patients, and they would be assigned to different residents. So I would say individually, I would be taking care of around 5 to 7 patients, and it also depended on the unit. So there was a different day where, a physician assistant called out sick on another floor in a COVID unit. And that day when I was covering, I was taking care of 10 plus patients. So it varied. And for our patients, I wasn't in an ICU setting, so our patients were not ventilated. They were considered the more mild to moderate COVID patients. But even in that situation, it was an entire range. I mean, they were elderly, they were middle-aged in their 40s, 50s, and there were also patients in their 30s. And that was something that was terrifying to see, because for a lot of the younger patients, I mean, not really any comorbidities. And when that first week when I was deployed and the cases were peaking in New York City and the hospital was completely flooded with patients, it was very scary. We had a lot of patients die, and patients who died, they were not only elderly, middle-aged, some younger patients as well. And it was really tough to see, because typically as physicians or just in the healthcare setting, we have our abilities to predict who may or may not do well. I think in the ICU setting, it's a little different. But for us on a COVID floor, the people who we thought were going to do well or not going to do well, it didn't always match up with how patients did. And things changed so rapidly, patients decompensated so quickly, that that's something that was it's traumatic. I think that is the most traumatic thing, that if you are on a COVID floor, work on a COVID floor in a setting where the hospital resources are completely spread thin and the numbers are overwhelming of patients, the rate at which you might be in a situation where you're having to pronounce a lot of patients dead. I mean, that was something that I was not used to. The residents that I was working with were not used to. Nobody in the hospital is used to that. And I mean, fortunately now things are better. But in that first week in April, when the numbers were going up and up and up in terms of the number of deaths in New York City, I mean, it was horrific. It was really bad and scary to see.
Now, the patients that you were seeing, I mean, I know you don't have, specific numbers about how many deaths you witnessed, but it sounds like you saw a lot of people die in the hospital from COVID. Would you say that a lot of the patients who, passed away from COVID, did they have other underlying health problems, or were there also a lot of people who had no other health problems and it was definitely just COVID that they passed from? Or did you see people who had other health problems that contributed to their death?
For what I saw from my perspective, I mean, there's so many complicating factors. I would say for a majority of patients, elderly do have other comorbidities, is the case. For some of the more younger patients that I saw, obesity, just being overweight, played a role. But in terms of it's really tough to say, because, the treatments that we have, the treatments that we're giving, I mean, none of it is evidence-based. And so what we are trying and giving to these patients, it was according to what a lot of the other hospitals in New York City were trying and what a lot of the reports were saying may be working. And in trying to do that, it's really hard to know and say what treatment is going to work for which patient and why. I mean, someone described it to me where it's as if you're trying to figure out the blueprints for a plane as if while it's mid-air flying. And seeing that in the hospital setting where, we don't understand this virus and we don't understand this disease, and it ravages so many different organ systems in so many different ways that, you know, the understanding of the pathophysiology of how that happens, it's still being figured out. And so that just made it really tough, you know, where we did our best in supporting, stabilizing, giving treatments that we know other people are giving, but some people just did not do well. And like I said, in certain situations, you could say it was comorbidities. In other situations, not necessarily. And that's just something where, you know, time and more research will tell.
Yeah, so you know, a lot of us, we see on the news that it seems like the lungs is the organ that gets most affected by the COVID virus, but it sounds like then it also attacked other organs as well.
Yeah, I mean, we saw a lot of patients with, I mean, diabetes going into diabetic ketoacidosis, COVID related. We saw a lot of patients where they didn't have kidney problems, but because of COVID, they had gone into acute kidney injury, and that with different varying severity. So for some, it was much more severe. For some, it was more mild and could be managed. We had a lot of patients who already had kidney problems or they were end-stage renal disease dialysis patients who there was a huge backlog of, this is something where, you know, while I was seeing this, then I would read the news and see that it wasn't necessarily just the ventilators that were in demand and the numbers of which were important, but dialysis machines became extremely important. And that was something where for the patients that we were getting and the need that was there for dialysis, there were certain complications of, you know, in not even just the lungs, but like the level of clotting and the fact that a lot of the dialysis machines, because these patients have so much of like a coagulopathy, that they were clotting off the dialysis machines. And I remember one day, you know, calling dialysis and them just being slammed with the fact that a lot of their machines need to be cleaned out with tubing needing to be changed. And so there were just so many things that, you know, we didn't recognize or even realize were going to be factors that are playing a role in terms of, you know, the hospital itself, any hospital being able to manage COVID in those numbers at that extreme, not knowing that this disease is affecting so many different organ systems. And, you know, you had brought up the lungs. I think the mentality of, well, is it a pneumonia or is it more of a clotting cascade disorder where, you know, not only just causing potentially pulmonary embolism in patients, but, you know, newer reports saying that, you know, patients having stroke-like presentation, having clots in different parts of the body. I mean, it's just, there's so much that we still need to figure out about this disease. So it is a very tough situation to see. And I think everybody was doing their absolute best to treat everyone, you know, with the standard of care that we know pre-COVID, but during peak surging COVID, I mean, it's the way that they describe it to be wartime conditions, I think is absolutely accurate. That's the only way to describe it, because you have to work with the resources that you have. And so it is not an ideal setting, which is scary.
Right, it is scary. How about your colleagues, you know, other healthcare providers, doctors, nurses in the hospital? Did you see any of them or very many of them losing their lives from the virus?
So in our hospital, unfortunately, we have had deaths, and you know, that's something where the whole community knows about it and is mourning it. So, you know, we've had a pulmonary critical care physician who trained at our hospital, has devoted his life to caring patients in our hospital, and he contracted COVID while taking care of COVID patients and was not doing well. Was in the ICU setting and unfortunately passed away just last week. It's devastating. It's heartbreaking in ways that it's hard to even put into words. the head nurse of our ER passed away as well from COVID, and a pediatric nurse also passed away from COVID. And I just, it affects your entire community. It affects your entire hospital. The number of healthcare providers, nurses, doctors, residents, even in New York City, but across the country and across the world that have passed away. When you look at the lists and the numbers and read their stories, I mean, it's very sad. So yeah, that's something that we've all been struggling with, because it could have been anyone, that's where you're almost potentially playing Russian roulette when you are working on a COVID unit, or, dealing with COVID, where why certain people and their bodies just respond and react in that way, and others recover, and why certain treatments work and don't work. We don't know yet.
Yeah, it's really heartbreaking. You're right. It is like wartime conditions, because there's still so much that has to be figured out. I wanted to also touch on, or maybe ask, do you have any stories in particular of any COVID patients that you were really touched by in a memorable way that you'd like to share?
Yeah, so one day in particular really stands out. I'll say, when I showed up in the morning, I had new patients, and two of my patients that morning, one patient only spoke Punjabi, which working on a COVID unit and knowing that there was nobody else on that unit who spoke Punjabi, and I happened to be able to speak some Punjabi, I mean, I felt very grateful that I could communicate with that patient. And, knowing that visitors are not allowed in the hospital, family members aren't allowed, all of the healthcare providers are dressed up in these alien Star Wars suits. It's very terrifying. It's scary in a way that I was happy that at least I could communicate to this patient in his native language that he could understand. So that really stood out. And simultaneously on that same day, I actually had another patient who spoke both English and Urdu. And when I asked him, which language he preferred to communicate in, he said he would be happy to speak in Urdu. And so also being able to speak Urdu, I, just spoke to him in his native tongue all day. And that felt very meaningful, because you're in a situation where it's so terrifying, it's so stressful. Those little ways of adding humanity to the care that you're providing, not just the medical care, but kind of what we say, kind of care of the whole person. It was very meaningful. And, luckily both of those patients did well. And I actually called them after too, to make sure they were doing okay. And that was something where, I was really happy to be on that floor, in terms of being able to do what I could, knowing what the situation was. I felt very humbled and honored to be able to help as a physician, because, I mean, when you see that level of suffering, it's scary. So.
Yeah, and I think, just not being able to have your family there too is a pretty scary thing. Were they pretty strict about not allowing any family in? Were these patients pretty much alone, would you say, during their time there?
Yeah. I mean, on our floor, the whole time that I was there, we did not have any family member that was allowed to come onto the unit. And, our entire unit was a COVID unit. And so we did our best to call family members, update them, have patients talk to their family members, provide phones if needed. Fortunately, at some point midway through, we were able to get a donation of iPads to the unit. So those were things in which we tried to overcome that barrier, but it's not the same. and it's really scary conditions to be admitted to the hospital in.
Yeah, and especially for those patients who were dying, were they dying alone, or did they have family who were allowed to come in and see them at that point where they were passing away?
So I think if it was predictable in a way where, based on certain criteria, you know that this patient is not going to have much time left, in those situations, they did allow for a family member. Our unit was a little different because it wasn't in the ICU setting. And I think, unfortunately, some of the deaths that were just more unpredictable in those situations, we weren't able to do that. And so I think that's what makes it really tough, is that you're not always able to know who's not going to do well and when and how, or prepare for it.
Yeah, that's the heartbreaking part. The stories you hear of these people who are passing away in the hospital without having their family there, but it sounds like, you've had such a memorable experience, one that I'm sure you'll never forget, especially knowing that you were able to at least provide that comfort of being able to, speak the language of some of those patients who were alone is really remarkable. That's something that I'm sure you won't forget, and the families probably won't forget. So that's really wonderful to hear that at least there's a comfort in knowing that there were some patients who benefited from having you there, particularly because of the language that you speak. So I guess in wrapping up the interview, is there any advice that you would like to give those of us watching the video on just, how to stay safe from COVID in general?
So I think taking all of the precautions that you can, that are in your control, and really leaving nothing up to chance is the most important thing for not only each person to do themselves, but for them to really get their family members and their friends to also be doing. And I think that includes making sure wearing a surgical mask anytime you're leaving your house, hand washing, of course, as much as you can all day long, really not leaving your house unnecessarily if you can avoid it, maintaining 6 feet of physical distance in any interactions that do occur. All of those safety measures, knowing that, God forbid, if anyone of any age were to get COVID, we just don't know enough about this disease yet, and we don't have the evidence-based treatments. Depending on where you might get admitted and how, it's just, there's so many complicating factors affecting whether you might live or potentially die from it. I think there is a certain level of fear everybody should have. And once I started working on the COVID unit, I became much more vocal about what I was seeing, because I realized that it's hard to understand it when all you see are just numbers or statistics on TV, or just you're reading them in the news. But when you actually see people who are admitted to the hospital, 30-something-year-old, mildly overweight, and had COVID, seemed as if it was more mild, not requiring that much oxygen, and they decompensated and died within a few hours. And you see that with your own eyes. And for example, in that situation, that patient got exposed working in a grocery store. And so he's one of those essential workers where he's high risk for exposure. And stories like that I didn't realize how much I need to emphasize those with my friends, with my family, with everyone I know on social media, to say, look, anything that you can avoid doing, it not only decreases the chances and protects you, but it protects someone else, that grocery store worker, your family, an elderly person, immunocompromised person, a obese, slightly overweight person. I think anything that we can do to protect ourselves in every way is the most important thing. And I've also been encouraging all of the healthcare providers that I know who are working on COVID to share their stories, share what they saw in as much detail as possible. You know, it's a balance where I don't want to be very morbid and be very depressing about it, but you almost need to a little bit to get the point across. Because I mean, it's annoying having to wear a mask. Like, I don't like having to do it either, but you have to keep in mind how terrifying this disease is and how much there is that we don't know, and just remind yourself of the importance of all of that.
You know, thank you so much for sharing that story with us, Neelam. And I guess I wanted to ask you, you know, you're finishing up your residency at the end of June. What is the next step for you after this?
So at this point, you know, I was planning on staying in New York City after residency and, you know, really spending a few more years here. But at this point, working on COVID, similar to how everybody is realizing that COVID really makes you face what your priorities are in life. And for myself, at least, graduating from a residency program, knowing that this is the first time in my life that I get to choose where I want to live and where I want to be, I think I'm really reevaluating that now, because I don't have family in New York City. And while I have loved living here and training here, that is potentially something where I want to be close to my family. You know, I want to not be so far away. And so I'm reevaluating all of it and going to figure it out in the next few months. So to be determined.
Oh, okay, great.
Yeah.
Well, you know, I think that it's great that you know, made such an impact in when you could, you know, when you were living in New York. And we at camp are really appreciative that you shared your story with us. And we definitely wish you the best in your future endeavors, you know, whatever that happens to be, whatever, you know, stay in touch, and we'd love to hear from you and just see, you know, what your next step ends up being as you progress in your career. And, you know, I just wanted to thank, again, Mohammed Atta for recording this video. And I just wanted to thank everybody for watching. If you, you know, did want to reach out to us, if you have any ideas for other, you know, topics or speakers, or if you want to even look us up on Facebook, just type in @CampOnline, and you can also reach us there and message us there. So if you'd like to see more virtual events like this, if you have ideas for topics or speakers, or if you'd like to join and help in planning events, whether it's becoming an officer or event planning, feel free to reach out to us as well. But, you know, hopefully everyone is having, you know, a peaceful and a blessed Ramadan, even though the circumstances are difficult. And in case if we don't get a chance to connect with you all before Eid, I hope everybody gets a chance to have, you know, a happy and a blessed Eid as well. So thank you, Dr. Khan, for joining us. And I hope you guys all have a great evening, and we'll be in touch soon. All right. So thank you so much, and have a good night.
Thank you, Mimi.
Bye.
Bye.